the inside story on the issues that affect you and your community. This is Local 12 Newsmakers.
Republican members of the House of Representatives have been scrambling for weeks to figure out what they want to do about health care and health insurance. Can they find a majority to support a plan put forth by Speaker Paul Ryan and backed by President Trump? Or do they have to scrap the whole thing and search for a different approach that can attract some Democratic votes? Good morning and welcome to Local 12 Newsmakers. I'm Dan Hurley. Since we are recording on Friday morning and don't know what is going to happen in Washington today, I want to focus this morning on two local initiatives who are addressing the health needs of residents of Southwest Ohio who already lack coverage or at least adequate coverage. In the second part of the show, we will focus on the Good Samaritan Health Clinic in Price Hill. We begin with the St. Vincent de Paul Charitable Pharmacy that operates out of the Liz Carter Outreach Center in the West End and in the new pharmacy inside the St. Vincent de Paul Thrift Store in Western Hills. For over 10 years, the Charitable Pharmacy has served as a last resort safety net pharmacy, providing completely free medication and professional pharmaceutical care to people in Hamilton, Butler, Warren, and Claremont counties. In that time, the pharmacy has filled over 340,000 prescriptions with an estimated total value of $38 million. 75% of those prescriptions are filled with donated medicines. To discuss the pharmacy, I am joined this morning by Mike Espel, the director of the St. Vincent de Paul Charitable Pharmacy. Mr. Espel has been with the pharmacy from the beginning and was named the 2017 Healthcare Hero by the Cincinnati Business Courier. And Lydia Bailey, the clinical pharmacist at the Charitable Pharmacy, who did her residency there last year and is now on staff. Welcome to Newsmakers.
Thanks, Dan.
And Mike, this effort has received a number of awards, the Healthcare Hero Awards, but also nationally, Robert Wood Johnson recognized, and you received another award recently, right?
Yes, and we went to the Henry Schein company. We were actually a Henry Schein Cares medalist. So we attended their meeting, their symposium, and we won an award there also.
So this is really making sort of national news, and congratulations on that for your work.
Thank you so much.
I want to take a look at a graph that you provided us that shows sort of the business that you've been doing over the years. And my question on this graph, it's a bar graph, is that what was the impact of when the American Affordable Care Act, the ACA, Obamacare went into activity, and the extension of Medicaid? Can we see that on this graph? Is that where the dip is?
That is where the dip is. And so in 2014 and around March, there were changes. Basically, Medicaid expansion reduced the number of people that we had by about 25%.
So you're saying it's the Medicaid expansion that was more impactful than ACA?
Yes, really. Actually, the Affordable Care Act really didn't impact us that much. And if you know more about the coverage of the Affordable Care Act, you would understand that we actually had to help some of those people too.
Well, we'll get to that in a minute.
Okay.
So there was that dip. But Lydia, it's come back up. Mm-hmm. So you're sort of back to where. Why has it come back up? Who are you serving?
Yeah.
Who comes into?
Well, before that dip, we were primarily serving just uninsured clients, the clients who don't have any insurance at all. Now we actually reach out to people who are underinsured. So Medicare Part D has really high copay, some $500 to $600 a month, which is unaffordable. And so now we're reaching out to patients that can just have trouble affording their medications even with insurance. And
so they have insurance, mm-hmm. but the copays keep them from filling the prescriptions that they need. And is this because they have prescriptions for really unusual drugs? Or does this hit people who have other sorts of issues.
Right, it's every day, it's all your neighbors. A lot of medications for diabetes and asthma and COPD are extremely expensive. New inhalers, new types of insulin are coming out, and one single vial for a manufacturer to make can charge $300. And so it's really unaffordable for everyday medications. It's not the unique medications that no one's on.
I want to take a look. You also had some you provided me some numbers about the populations and of who you serve. And one of the interesting things, and we'll put that up, but one of the interesting things to me was the split between the geography, that 50% are coming from the city, which I assume you mean the city of Cincinnati, or at least the urbanized center of Hamilton County,
right,
and 50% from the suburbs. Mike, is that changing over time?
It really isn't changing much, and we were able to generate that through looking at zip codes on our prescriptions. So there are a significant number of people in the suburbs that need help. And I think most people have the idea that we take care of mostly inner city and homeless patients. Homeless patients are covered through federal grants, through the health department. But it's a lot of these people in the suburbs that really need help, that are your neighbors, that need assistance with their prescriptions.
But may not know that they need that kind of help.
Right.
So is it a big step for some people to find you and to come in and on their own, from their side, to say, oh, I need this help?
Yeah. Absolutely. We, as an organization, we really want everyone to feel dignified when they walk through the door, but just imagine you having to go and ask for help for something that people don't think you need help for. It's tough to come in, but I think once people do find their way in, they realize that we're all getting help one way or the other. It's not us giving you a handout. It really is neighbors helping neighbors.
And it looks to me like diabetes is one of the diseases, conditions that really seems to be a staple of what you're responding to. Is that right?
That is true, and our statistics show 48% of our clients are diabetics. So diabetes is it's a chronic disease that has to be treated, lots of complications in the long run. And we have been able to show with our outcomes over, especially the last few years, that we are making an impact on those patients and we're improving their diabetes control.
Would there be people coming into you who know they have diabetes but haven't been dealing with it at all in a medical sense?
Absolutely. We had a patient a few months ago who knew he had diabetes. He had gotten diagnosed in the hospital. They had written prescriptions for him, and he'd never gotten them filled. He had gone months without taking any medicine. And when he finally came to us...
Because he couldn't afford it?
Because he couldn't afford it. And when he finally came to us, his diabetes was very out of control. He was at a really high risk for heart attack and stroke because of that. And then 6 months later, after we had given him medications each month and counseled him on what diabetes is, how to take his medications, he was way under the goal that we try to have. So just within 6 months, he was back at really great health, which was awesome to see.
One of the things I noticed in this, and it sort of goes back to that graph a little bit too, is that once you get people in, and it's especially for chronic diseases, it's getting people on a routine that they stay with at the right levels, that they're not, I suspect, cutting pills in half, they're doing what, and therefore, it's continuous care. It's not a one-time, we'll come in, we'll solve your problem type of thing.
No, in our clinical activity now, we follow up with all the patients. We develop a plan for them, so a care plan, and then we carry out that care plan by continual follow-up.
So who's actually following up? What's your staff look like?
So we have not only...
She's laughing over there.
Yeah.
Well, and go ahead, Lydia, why don't you talk about it?
Well, the staff, we have a few people who we're able to fund and pay salaries for, but most of our staff are volunteers. So we have volunteer pharmacists who come in, and our main clinical program is actually run by students completing their last year of pharmacy school.
Which was you last year, right?
Which was me previously, yep, exactly. So we're able to utilize these students who love getting the experience and the practice, and they really help us. We wouldn't be able to do what we do without all the volunteer work and all the students that we have.
The other piece of data that we flew by early on, where do you get your medicines? Where do you get these? Because this is prescription medicine. We're not talking
That's
about.
correct.
We're not talking about Bufferin being across. We're talking about prescription medicine. Where are you getting that? This is expensive stuff for you.
So 75% of it is from donated sources. We have to cobble together a whole bunch of different donated sources. So we're talking about, locally, we get samples from physician offices. And lately we've had more success with getting more and more practices to donate those samples.
So if doctors are hearing this,
yes.
I mean, literally, what does that mean? Why would they have enough that makes any difference that are in their office?
So a lot of the manufacturers will drop off excess amounts of samples to them, and what we encourage them to do is, especially before they expire, to get them to the charitable pharmacy so that we can dispense them. Even the short-dated stuff we can find a use for. So if those physician offices are out there, and if there's physicians out there that are hearing this, we would really like, if they're not currently partnering with us, we would really like to see that partnering.
And I'm going to give the telephone number in a few minutes here. So besides doctors' offices, are there drug companies?
There's drug companies that do bulk assistance programs with us. There's international organizations that have medications, donated medications. It's kind of a willy-nilly smattering of things, but when we put all these different donated sources together, we are able to put it all together to get to that 75%. One thing I will mention, Key Source Medical, a local wholesaler, generic wholesaler, that actually gives us about $50,000 worth of donated generics each year.
Generics, so
yes.
that fills in out of that brand name.
Yes, yes.
So how do you measure outcomes? How do you know? We live in a world where measurement is critical.
Right.
How do you know that you're making a difference? How do you know that you're having success?
Yeah. Our pharmacy manager, Rusty Currington, he actually started a program for all of our clinical services. And so what we do every 6 months for every single patient is we have a sit-down, usually hour-long meeting. We go over every medicine, every doctor, every disease state, and we do a health screening with their blood sugar, their blood pressure, things like that. And each time, we're looking to see where are the problems at, where are the gaps in care, and we have an electronic-based system that we can input all that information into. And since we're having that consistent follow-up, it generates these great outcomes that we're able to track.
So this is really, the point I want to make here is this is a sophisticated operation you're running here. This is, I'm
Absolutely.
so impressed by what you do, not only in terms of dispensing, but following up with patients, following up with data,
right.
and knowing what impact you're going to have. It's just really impressive.
Right.
I'm almost out of time, and I'm going to ask her a question. Mike, and you and I know each other, but Lydia, how's this going to change your career as a pharmacist? You're at the beginning of this career. The fact that you have begun with your residency and now
right.
working at this kind of pharmacy, how do you think that's going to change who you are?
It's already changed so much. Getting to work with Mike as a mentor and as a director, I've never had someone with such leadership potential mentor me in that way. So I didn't know where my life was going before I was able to work with him. And so seeing how he follows his passions and how he uses faith to drive him every day is something I want to do. I want to be like him. So I'm not going anywhere. So as far as where my career's going, I'm gonna stay here as long as I can.
I'd say that sounds like it's a pretty darn good compliment for your
thank
work.
you.
And thank you for your work. I want to make sure people know how to get in touch.
Yeah.
To reach the pharmacy and find out more about their services that are available, as well as ways that you can help, whether you're a doctor, like we were just talking about, and can donate medicine, or a pharmacist who would like to volunteer, or someone who wants to support the effort financially, go to the website, SVDP, St. Vincent de Paul, svdpcincinnati.org, or call 513-562-8841, extension 228 or 230. Thank you for being here this morning. Thank you for the work you're doing. And we know it's going to continue no matter what happens in Washington.
Thanks.
So stay tuned. After the break, a clinic in Price Hill staffed completely by volunteer medical professionals. Welcome back. Beginning in 2011, Good Samaritan Hospital, a part of the TriHealth Group, opened a free health center in Price Hill to allow uninsured adults to establish a medical home. The center, located in the 3700 block of St. Lawrence Street, provides a wide range of services from primary care to physical therapy, as well as dental and psychological services, all delivered by volunteer health professionals who work at the health center and are especially concerned about chronic diseases like diabetes and hypertension, like we were talking about in the first part of the show. To talk about the work of the Good Samaritan Health Center, I am joined now by Linda Smith-Berry, the manager of the Free Health Center. A nurse by profession, Linda has served on many boards and local institutions over the years, including Good Samaritan Hospital, Seton High School Dress for Success. She was named Inquirer Woman of the Year, but is best known to me as a member of Class 33 of Leadership Cincinnati, who she will tell you is the best class, but they all say that. And Dr. Steve Eby, who is the medical director at the Price Hill Good Samaritan Center, and started out as a volunteer, but is now an employee of the center. So welcome to Newsmakers.
Glad to be here.
You know, when we say this is a center driven by volunteers, what are we talking about? What kind of staff, what kind of volunteer staff do you have, Linda?
At this point, we probably have about 200 to 225 volunteers that float through on a monthly basis. We run...
So just coordinating that many volunteers.
Yeah. And we have about 70 different 3-hour medicine sessions a month. So the last several months, we've been making about 900 appointments. So not only do we offer general medicine family practice, we also have a number of volunteers who are specialists. So we can offer dermatology, rheumatology, GI disease, infectious disease, I know I'm leaving out. Endocrinology.
Quite a few. Not everything, but...
Yeah, but a lot.
And Steve, who is it that you're seeing? Who are the people who come to the center? Why do they need you?
Well, the center's designed for folks in Hamilton County that really have no place else to go. The working poor. No Medicare, no Medicaid, no insurance.
So does that mean it tends to be adults as opposed to children?
Yes. 18 and over.
And not pregnant.
And not pregnant because...
There's a lot of services in the area for pediatrics and for maternity.
Okay.
But yeah, these are folks that, in most cases, literally have no place else to go.
Yeah.
And that term, a medical home, which I pulled from your website, but that's part of all of what medicine has tried to do, to make sure that everybody has some place that they say, I've got a primary care physician, I know who I can call and depend on, and who knows my history and
That's
my
how
background.
we try to run it.
Correct. And we have a lot of services and processes in place to help make that happen. So if one of our patients goes to an emergency room, we get notified the next day that that happened, and they get a phone call from us. And we have them make an appointment to be seen so we can follow up on whatever the issue was that they went to the emergency room for. Having dental services, mental health services, a full-time dietitian, and then in June through St. Vincent's, we'll have a full-time pharmacist. And we'll be able to educate people.
You'll have a full-time pharmacist.
Correct. We won't be dispensing medicine, but it will be for education, so that people can understand what they're taking for their diabetes or their hypertension, and how to take it, what it does. And the whole goal, I think, that, you know, Steve and I try and aim for is not just to keep people from being sick. We want to help make people well. So in order to do that, we have to educate them.
So it's wellness.
It is wellness-based.
It's not sick
just
care.
sick. Well, it's sick care.
It's sick
as
care,
well.
but it's...
Yes,
We're on a first name basis with the ER people too.
Yeah.
We've had transfers.
But we try really, really hard to partner with the patients to help them become well.
Steve, you started out as a volunteer, you mentioned to me. What caused you, I mean, I know enough doctors. I know if they're in practice, there's a lot of pressures on them. There's a lot of demands. What caused you to decide you wanted to, and through you, maybe you can talk about other doctors who are there. Why do people
That's
volunteer?
a good question. I think that to a large degree, these are folks, not just the doctors, but the dentists, the nurses, the people that help at the front desk, everybody, who want to give back to the community. They truly do. And I know in my case particularly, it's very nice to go in and be a doctor and practice medicine with very little of the other obstructions, rigmarole, paperwork. You know, I've always told folks I'm very happy to work there because I have no insurance forms to fill out. Nobody's got insurance.
No. So you're not looking to get reimbursed by
heavens
Medicaid
no.
or
We
none of
receive
that?
no income.
No income at all?
Correct.
You know, thank
Everything
goodness
is
we've
free.
got support from
Yes.
the Good Sam Foundation and other
Right.
very generous donors. But yeah,
But it's really the volunteer, day by day
That's what
work
drives it.
that
Yes.
drives this.
I actually added up the amount of financial service that was donated last year, and it was around $2 million of free service that was given to patients.
Okay, the value of it.
The value of it,
The value
correct.
of it. Being in Price Hill, what sort of, how would you describe the demographics of the population that you serve?
rather
Interesting.
broadly.
Broadly and interesting. And keep in mind, we do service all of Hamilton County now.
Right.
So the Free Health Center is the largest urban health center in the state of Ohio now.
Wow.
And, you know, the demographics of people that we see are interesting, but on the other hand, you kind of hear their stories and you think, you know, only by the grace of God go I. That could be me. Because they've had something catastrophic happen in their lives that have caused financial difficulties, or they've lost jobs through no fault of their own, and they wind up without health care.
And do you see people who, because they're getting health care, can get other parts of their lives maybe more
Lord,
stable
yes.
as well?
Well, we were just talking earlier about an example of a young man who came to the clinic with multiple serious problems, again through no fault of his own, and with a lot of care and coordination involving not just us, but the university clinics, now has gotten I think an associate's degree and a job. He dropped by the other day just to say hi.
And he had hitchhiked from Michigan, had no parents that were involved in his life, and we found him sleeping outside our front door.
That's how you first
And
contacted them?
that's how we first met him.
And and there are other folks who, you know, it's hard to hold down a job when you're sick all the time because you can't afford your medicines and you can't see the doctor. You have a, you know, ridiculously high deductible, and when you can turn that around, people do better.
You know that the first part of the show were the people from the St. Vincent de Paul Charitable Pharmacy. What's your interaction with, and there is now a pharmacy in Western Hills
Correct.
that is opened under St. Vincent de Paul as well. They've expanded over there.
Correct.
What's your interaction between those two organizations?
Oh, we work hand
Hand
in
in
hand.
hand.
I really think we do. We share a lot of patients. And now St. Vincent's has a physical presence at the Free Health Center. And starting in June, they will have a full-time presence for us. In doing teaching, we're going to wind up being a recipient of one of their residents. So it is hugely helpful. You have to have all of those different pieces in order for a patient to really understand what's going on.
Steve, if there are healthcare professionals, doctors or nurses who listen to this, what would you say to them about the possibility of joining your effort?
We do need more primary care people. We'd be happy to have somebody call and volunteer. Call me or Linda. It's a great opportunity to be a real doctor with a lot less aggravation than private practice currently has.
Yeah. Well, and you
And
know,
we're almost out of time. but-
right. Well, and there's this little There's a little phrase that I use that says it's a medical mission close to home. People like to go on medical missions. You can come and practice at the Free Health Center and have the same experience.
Let's make sure people know how to find you. If you would like information about the Good Samaritan Free Health Center, it is located at 37, I think it's 27 actually, St. Lawrence Street in Price Hill. You can call 513-246-6888 for information about services, or to volunteer, or to donate, or all sorts of things. Thank you very much for being here this morning.
Thank you.
Thank you for the work you do.
Thank you, thank you.
Thank you for making Newsmakers a part of your Sunday morning. Join us next week to meet the women and the men working creatively to make our region better for the future. Have a good week.